Namaste. I am Dr. Priyesh Patel, medical gastroenterologist and liver specialist and a hepatologist and transplant specialist. So, brief talk about today about basics of liver. So, I get a lot many patients who have a lot of misconceptions about the liver. They feel that liver का तकलीफ है तो ये खाएंगे तो गड़बड़ हो जाएगा, या liver का तकलीफ है तो ये नहीं करना चाहिए, या there is a misconception also about के they have a liver disease when there is something related to stomach and not a liver disease for sure. As good as I've got patients who come and tell me that they get jaundice every year, उसकी वजह से होता है, या they get liver का issues, that is why they पचन नहीं होता है. So lot many issues related to liver. So I thought why not start with a series of talks where we can help you out by giving some basic idea about what exactly is a liver and what does a liver do per se. So just to have a side, this is a replica of a model of a liver which is there inside the human body. So liver by far is supposed to be the largest organ inside the human body, and it has got n number of functions. So most commonly people feel that liver is related to digestion, and because the digestion is not proper, there would be some sort of a liver disease, and then they start taking some medications which are over the counter, which may not be really helpful and which may not be the ideal medicines for the liver per se. So as I mentioned, liver is the most largest organ of the human body. And apart from being the largest organ, it has got many functions. Most common functions are synthesis of protein, synthesis of hormones, synthesis of various enzymes for digestion and for other aids also, and breakdown of each and everything what you eat is also broken down by the liver enzymes and metabolites. Even whatever medicines we take is broken down by the liver and then presented to the blood in a manner that the blood has to spread it to the organs, whichever organ the medicine is required for. So liver has got so many functions. We feel the medicine which we are taking are not harmful or are not having any effect or any side effects, but eventually everything is broken down by the liver. So liver is a most important organ of the body by being the first filter of whatever we consume by food, even by inhalation. Whatever is supposed to go inside the blood is first broken down by the liver and then only presented to the blood, so that it is in a purified manner, so that it goes to the various organs, like whatever organ you're supposed to, the blood has to go, and then it goes throughout the body. Apart from the basic functions, liver is having a lot of diseases also. So there are many diseases related to liver. Most common disease or most common ailment which somebody will be realizing that they have a liver issue is probably fatty liver, where they will go for some sonography for some routine checkup, or maybe some gynec related issues, or maybe they have some pain in the abdomen which is pretty vague, and when the doctor advises to do a sonography, the most common finding would probably be a fatty liver. Apart from fatty liver, there are other viruses, hepatitis A, hepatitis B, hepatitis C, hepatitis D, hepatitis E. So these are the viruses which affect the liver in the form of a injury to the liver. Apart from hepatitis and viruses and apart from fatty liver, there are other diseases like cirrhosis of liver or chronic liver disease, which may be because of many reasons. One of the most common reasons is alcohol, but by far alcohol is not the commonest reason in this part of the world. Slowly and steadily, obesity or overweight and increase in abdominal diameter, increase in the girth of the abdomen, and uncontrolled diabetes are going to be the leading cause of a liver cirrhosis or chronic liver disease. Most of the disease of the liver do not have any symptoms. They present as a chance finding, and by the time the symptoms come, it is very late and the disease has really progressed to a certain stage where reversal is not possible. However, the good thing is that most of the disease of the liver are reversible or definitely treated. Only thing required is a proper time and proper diagnosis, at which time we need to find out what exactly is going on. So if somebody is having as an innocuous appearance as a fatty liver or some sort of a hepatitis or any ailment related to liver in the form of cirrhosis or chronic liver disease, or any doubt related to a liver disease, he or she requires a thorough checkup, and only then we can justify whether the person in question requires any medications or does not require any medications. So most of the times the medicines related to liver are pretty few and far between. There are many patients of mine who would be taking some sort of alcohol on a daily basis and will pop in a certain medication which I will not name, thinking that the liver will stay healthy, which does not work. God has not created us in that manner to do a positive effect in the morning and a negative effect in the night. I don't think that works. So obviously healthy lifestyle is the most important treatment for any ailment, and the liver is not an exception to the rule. Most important things: no over the counter medications, control the weight, daily exercise is the gold standard in most of the ailments, be it heart, be it liver, be it fatty liver, be it cholesterol. So liver is not an exception in that case for sure. And apart from that, obviously if there is an ailment, we need to diagnose it and then treat it subsequently. There would be no one size glove which fits all कि उसको भी दिया था तो मुझे भी लेना चाहिए, मुझे भी काम करेगा. I don't think that works in any of the medical conditions, definitely not in case of a liver disease. There are certain patients who progress in spite of all proper precautions and everything, where we call as chronic liver disease or cirrhosis of liver. In these kind of patients, there could be more major symptoms would be either jaundice or yellowing of the eyes, fluid in the stomach that is called ascites, vomiting with blood, or some sort of a altered sensory. When these are the symptoms which are present, we label it as chronic liver disease or cirrhosis, and these are the patients which require regular follow-up on a long term. A few of these may also require liver transplantation, but if it is done or if everything is kind of found out at a very early stage, then many will not probably progress to a cirrhosis of liver, and out of which not many will progress to a stage where liver transplantation is required. So the basic take-home message would be: leave your liver alone by not taking any not required medications. Keep it healthy by having a physical activity and a good lifestyle, and obviously curtailing and avoiding over-the-counter medications, smoking, alcohol, tobacco in that format, and having a regular checkup. I think these are the only things which are required, and obviously if there is a disease, it will require further investigations and further treatment. And I would like to continue these kind of small videos based on the liver. So this topic today, I thought I'll just cover the liver basically in broad sense for everyone, that at least we know what exactly is going on, because there are a lot of misconceptions about the liver. And let's see how it works. Hopefully I'll be covering one topic about the liver in the coming few weeks, and that should keep us connected. Thank you for it.